talks. And I'm going to talk a little bit after lunch about the Ophthalmology Foundation accreditation program that Dr. Seema just discussed, and how one can go about, yeah, there it is, how one can go about getting accredited by international standards. But this talk is on giving effective feedback, and Helena already made several points, and in the interest of time, I'm going to try to sort of go through this quickly. My objectives are to describe the need for feedback. We've already heard a lot this morning about the need for feedback. Define formative and summative, which I think has already been done. Define principles of good feedback, and hopefully to convince you to use more feedback in your everyday teaching. So formative feedback, as I mentioned, I like to think of it as behavior modification. So we are trying to enhance good behaviors and improve not so great behaviors. Versus summative, which means have you met the final grade? Have you graduated from your residency? I think another word for formative feedback is teaching. So I'm going to show you a video. This is a video that we shot. This is ad-libbed. There was no script to this. This is Andy Lee, a good friend of mine, and my medical student when I was a resident. You can imagine that, if you know Andy. And so the scenario here is, I am the residency program director. He is a resident, and he is very smart, but he is missing lectures, and he's late. And so I'm giving him feedback. So take a look and tell me what you think. This has audio, guys, in the back.
Audio.
Try again. Hey, Dr. Lee. How you doing?
Good.
Listen, I've been hearing some problems have been occurring.
Problems?
Yeah.
Not with me.
Well, I've heard from at least a couple people that you're not showing up and lazy.
Lazy? I have a lot of things, Dr. Gold. They're not lazy.
Well, I've heard that you've been late to conferences on some occasions and have missed a few.
I don't need those conferences. I just study at home.
Yeah, well,
I'm 99th percentile on the board.
I know you're doing very well on the board and you're doing well on the tests, but we've talked about punctuality and professionalism in the past, and I just need it fixed.
I just don't get anything out of those lectures, Dr.
Well, we need it fixed. We need you to help.
Half the time the lecture is wrong.
Nevertheless, I need it fixed. So do your best, and I expect it to be fixed. No more tardiness, no more missing lectures.
Well, if you say so, sir.
All right.
Sure.
Okay, so normally I would ask everyone to tell me what they thought was good or bad about that, but we don't have time. So I'm going to show you the video on improved version after I say a few words about giving good feedback. So formative feedback should be frequent and timely. Helena said that. If your dog pees on the rug, you don't hit your dog a week later and say, bad dog. Right? The dog's wondering, why? What did I do? You want to do it as quickly as you can after the observed behavior, and if possible, firsthand. So when I first became a program director, I'd hear the story from a faculty member. I can't believe the resident did that. And I go call that resident up. I can't believe you did. And then I got their side of the story. So I always get the other side of the story. Make sure if it's not firsthand, get the other side of the story. We'll talk about how. It should be designed to improve performance. But remember that feedback's not just for people who aren't doing well. It's to reinforce good behaviors. Because I definitely have residents say, I don't really know how I'm doing. And they're doing great, but no one's telling them they're doing great. They're just not telling them they're doing anything terrible. So you want to reinforce the good behaviors so they keep doing it and correct the behaviors that need to be corrected. And so Helena mentioned this, the ask, tell, ask sandwich. And so the first ask is, how do you think it went? So get their opinion so you don't have to figure out what they're thinking. What did you do well? How did it go for you? And listen to what they have to say. The delivery of the tell, be objective and specific and constructive. You're trying to either reinforce something they're doing well or make some improvements. So you should focus on behavior, not the person or the personality, like I use the word, you're lazy. What does that mean? Use the SMART system. Specific comments in small bites, measurable outcomes, accountability. If the learner doesn't think he's wrong or he needs to be changed, he's not going to change. And I think with that first video, He didn't think he's smart. He doesn't need to go to the lectures. Is he really going to change? Make the recommendations for change realistic. You can't go from, the first percentile on your exam to the 100th percentile in a month, for instance. And timely, I already mentioned. So some examples. Bad. Too general. You're not doing it right. How do I fix that? Versus specific. You can improve your technique by, I can fix that. Judgmental. Your history was terrible. Versus, your history was too long and not focused on the chief complaint. I can fix that. Personal. You're just not reliable. Versus, sometimes you forget to dictate the operative note. Okay. So those things on the right, fixable. On the left, not fixable. So the second ask, what would you do differently? Maybe we should consider this, or we should work on this. Let's monitor the improvement together, and let's meet in a month or whatever the right time frame is to see how we're progressing. So let me show you another version of the video with audio.
Thanks for coming in. I'm curious, and I know we meet once in a while to talk about how things are going, and I'm curious how you feel like you're doing.
I think I'm doing great. I'm like 99% on boards.
And I think there's no question you get the highest scores really of our residents on those tests that you've been taking. And I think you're doing very well. So however you're studying is working. Anything else? Any problems? Or?
Sometimes I don't think I get as much out of the lectures as I should be, so I stopped going.
Right. Well, we talked about at the very beginning of the year about punctuality and about our expectations. And although you're right, you do very well on the tests, it sets a real bad example. And I think some of the other residents look up to you, and they may not know how well you're doing and how well they're doing. They may get the wrong idea. So from a professionalism standpoint, I think it's important that we try to fix the problem. And we do take attendance. We do even sort of have the professors know if your people are late. And I can tell you that you've missed, as you just said, you've missed 5 lectures in the last month, and you've been late to 5 more. And that's, I think our next closest resident's been late to 1 lecture and has missed none. So you're clearly you're an outlier as far as that goes.
Wow, I didn't realize you took attendance or you noticed I wasn't there. I thought you just had to get high score on attendance.
Well, part of being a resident and being in the program is to go to the lectures and set a good example. So I think what we'd like to do is try to have you attend the lectures. And I know you may not think you're getting a lot out of it, but and I know you're doing well, but I think attending the lectures is part of being a resident in this program, and being on time is important. So we're, of course, going to continue to monitor that, and hopefully when we meet again in a month or so, we'll be able to have a bit different conversation. I really think that if we can fix this issue, you could be one of our very best residents.
I definitely want to be the best resident.
Okay. Well, we'll plan on meeting in another month or so. We'll see how things go, and we'll monitor things and take it from there.
I promise you I'll be there.
Okay. Thank you.
Okay, so a much different scenario. I think he felt accountable perhaps, but tried to give him some data. You missed 5, the next closest is this, and explain to him what the problem is. So a better example. So feedback should be useful. It should point the learner in the right direction, whether they're doing well or they need improvement. It should improve their performance and motivate them. And remember to give feedback to all your learners. It's easy to tell someone who's not doing well, they're way down here, how to get better. But someone who's up here that you want to make great, that's harder. But you got to figure out how to do that. Failing to give feedback, well, it leads to mixed messages, false interpretation by the learner. They may think they're really good and they're not, or vice versa. And then ultimately lack of trust in you, the teacher. So, in summary, feedback is crucial. Try the ask, tell, ask sandwich. Checklists and rubrics, which you've heard about, can create structure and make the assessment and the feedback more objective. I gave this talk some years ago at Aravind. We have an IXL course every year, and my daughter happened to be visiting, and she just happened to be there for this one short lecture, and she came up to me, she was, I think, 16, She came up to me at the end of the lecture and said, "Dad, you don't give me the feedback sandwich." So I think you're right. So hopefully I've convinced you to use more feedback in your teaching. Thanks for your attention.